Hi everybody, Scott Taylor here from Southwest Family Medical in Mesa, Arizona. We've been getting a lot of questions about semaglutide medical weight loss. It's something that we've been doing in the clinic now for about a year and a half or so. But most people, when they ask, well, what is semaglutide? What is it used for? Hey, I thought this was for people with diabetes. And you're right, it started out as a management for type 2 diabetes. But what a lot of doctors found is that it was very effective in helping folks manage their weight as well. Not only getting their hemoglobin A1C down, but it was also helping them manage weight and even lose weight. And so it's been approved by the FDA to help people lose weight. So I have been a patient now since January. Right now, this current video is being made in October. So I'm down almost 100 pounds. Now, this cannot guarantee this amount of weight loss. But for me personally, when I started taking semaglutide, it really helped curb my appetite, and it made those cravings, that 9:30 at night craving for a bowl of cereal and some cookies or some ice cream, kind of took that all away for me. It made me feel really, really good, and I really kind of changed my mindset. I wasn't always just constantly looking for something to eat again. I ate what I should eat and nothing more, nothing less. I did really focus on protein intake, and that's something that we'll teach our patients that we work with on it. So it's really important that you continue to keep your calories up and specifically your protein counts. We don't want you to lose that lean muscle mass that is good for you long term. Nobody wants to take semaglutide, lose a bunch of weight, 6 months later gain it all back. Been there, done that. It's not fun, and it's not healthy for you. So when we're teaching patients about the effectiveness of it, we really, really focus on health and nutrition as well. It's not just about losing as much weight as fast as you can. So we have that conversation with every single patient. Now, semaglutide, it's taken once a week. It's an injectable. It can be subcutaneous, so you can, like I would do mine, I'd pinch a little roll of fat right here and just kind of poke it sideways into my skin. The needle's very small. It's like a little insulin syringe. It's so thin, if I held it up, you wouldn't even be able to see it. So even if you're scared of needles, it's really not that hard to get used to doing that. And if you're one of our patients, we have you come in, we train you how to do it, we teach you how to do it, and make it so simple for you. And that's another thing, a lot of misconceptions out there. We don't need to titrate up or increase the dosage if you're doing fine. So let's say you're losing weight, you're doing really good. We don't need to increase that dose. So that's an important concept that we've found over the years, is you don't always have to follow a very strict regimen of titrating up to a high dose. You can have great results at low doses. You might titrate up and then get great results again, and then you stay there. So we just work with you and specifically with how you are feeling and how your weight loss goals are going. Other than that, a lot of people ask me, well, is it covered by my insurance? Well, it depends. The name brand called Ozempic sometimes can be covered by your health insurance. In our office and a lot of offices throughout the country, we don't use patients' insurance because it's often declined and they make you jump through a lot of hoops, even if it might at some point be covered by your health plan. But health savings accounts, things like that are flex spending accounts, it's covered through those. Other than that, most people ask me, okay, so what do I do once I get to my goal weight? What's my next step? So we work with our patients and we'll taper them off or titrate them down and help them get off the medication. Hopefully we've instilled and replaced some negative behaviors of overeating, portion control, lack of exercise with going to the gym, going for walks, eating healthy foods, doing meal prep, getting your protein count in. And if we replace those negative habits and we get you to a good, healthy weight, oftentimes we get you completely off the medication and you have great success, hopefully for years and years to come. So please, if you have any questions or comments or concerns, reach out to us. Check out some of our other videos, but please do your research. There's a lot of misconceptions out there. There's different types and different brands, different concentrations is another thing. Oftentimes you can find semaglutide on the internet. You don't necessarily know what you're getting all the time, so please use your reputable provider when you're taking this medication. Thanks you very much and have an awesome day.